Dr. Shao-Jen Weng is a professor in the Department of Industrial Engineering and Enterprise Information at Tunghai University in Taiwan. In addition, he is the principal investigator and CEO of Healthcare Systems Consortium. Healthcare Systems Consortium was established at Tunghai University by the funding from the Ministry of Science and Technology in 2017. HSC discusses hospital systems and patient needs and develops service products conforming to patient needs to improve healthcare quality management. There are more than 1,500 partners in HSC with more than 80 hospital academia collaboration projects with 40 seminars and workshops held and more than 2,000 participants. Dr. Weng, I would really thank you for taking the time out to be a speaker for our session today. We could begin, please.
Sure, thank you. Hello, everyone. Right now it's a Thai afternoon in Taiwan. So in Taiwan, I have to say good afternoon. In your country, maybe I have to say good morning. Okay, this is Shao-Jen Weng. She said that right now I'm a professor in the Tunghai University, and I create a healthcare system consulting this platform. Most of the in this platform, actually we try to invite the expert from hospital and also from the industry. Also, we invite some expertise from the government side. You know that in healthcare area, like the broad area, if we want to create something new in healthcare, definitely we need all the experts from different areas. So that is the original concept where we are trying to invite a lot of expertise if they are interested in smart healthcare. So in our board of the HSC director, we have the one chairman and the 3 vice chairmen, 3 from hospital, 1 from industry. As the photo, you can see that our organization, we established it from 2017 up to now is almost like 6 years. Every year we hold the annual meeting together. We would like to share what we did in the previous year, or we have to tell them that what's our new vision in the following years. Also, you can see that actually there are a lot of expertise from different areas. We are not involved only students. We hope students can do the service in the annual meeting. Also, we invite a lot of professors from the academia, also from the hospital. We know that the different professor or hospital management, they have the different skill or they have different resource. So we try to give them some position in this team. If once they have the position in the team, definitely they have to try to find the cooperation opportunity. We can do something together. So that is our propose. Actually, right now in this platform, we have the 1,500 members. Some of them from hospital side. So I think right now, up to now, there are 20 hospitals in Taiwan. They join this platform. Also, there are 40 industry companies. They join this platform. In addition, we know that some public organization, they are interested about the healthcare. So we also invite them to join. And academia from the university side, there are 3% of the members from the university side. So that's a pretty, actually that is a pretty good group. We are trying to develop the smart healthcare in Taiwan right now. And as we know that we got a funding from the most, and we trying to create this platform and try to do the medical rescue resource integration platform service for the public sector. And embed the expertise team. Also, we invite the private sector. For example, some company they are interested about the smart healthcare. They would like to join or they would like to support a technique or equipment. Based on those resources and the platform, actually we serve for the HSC members. Some of them from hospital, some of them from the government side and the industry. Actually, in my team, we are trying to do the operation improvement for hospital. In the hospital, we know that they are long patient waiting time, maybe their operation efficiency that is not good, that is less efficient. So we are trying to help them to do the process improvement. So that is the main service we are doing for the hospital side. What type of service we provide? We create the industry academia collaboration project. So we right now, I think we are close to finish almost like 100 projects with the hospitals, and we develop a lot of different system, or we call the smart system. So that is the industry cooperation. We had that type of experience. Also, in this platform, we are trying to provide a workshop forum, and then we let different friends they can join this group, and they are trying to know what type of resource they can find, or what type of skill, what type of service, or what type of the friends, what type of partner they can find. Actually, this is another concept. For example, if we want to find something or buy something in US, definitely we will think about Amazon.com. So right now, in Taiwan, we have the good medical service. So we would like to create a TaiwanHealth.com. Once the foreigner they want to find some cooperation or equipment with the Taiwan friends or Taiwan company, definitely they can get into the HSC. Then HSC can provide that type of service for the foreigner friends. Okay. Also, right now HSC that is located in the middle of the Taiwan. So in the middle of Taiwan, that area provides a lot of medical device, medical equipment. So we hope we can try to do the marketing for those medical device and try to connect with the some buyer from the overseas. So that is another business we are trying to help for the company in middle of Taiwan. Another the last service we provide, international patient service. A lot of foreigner they want to do some medical treatment. Maybe that is not easy in their country, or maybe that the cost is very expensive. At that time, they can think about the medical treatment in Taiwan. In Taiwan, we have I think the one of the top 5 medical treatment in the world. So we hope they can get into Taiwan, then we do a treatment for them, and once they cure, and that medical cost is less. So that is we call the international patient service. So if you need that type of service, just give us a call. Then we can do the free evaluation in 3 days. Then we give you a report, what type of the problem you have, and what type of cure, what kind of diagnostics we will do, and we will provide what type of treatment. Also, if you accept that the evaluation, we will tell you what is the bill, what you have to pay. So that is the 3-day free evaluation. This is another video from the medical treatment. But the medical treatment in Taiwan, that we can say that is one of the top of medical treatment in the world. So we hope a lot of friends or foreigner they can come to Taiwan to do the treatment. Also, they can find the medical device and equipment. We know that Taiwan, we have the good semiconductor company, we have the ICT, that type of company. So we hope semiconductor company and the IC company, they can help the medical area, medical device development. So we can provide that type of information. So actually see that we have a great opening in 2017. We have a lot of medical doctor, nurse, and company, they join these groups. So we have a good organization right now. So let me introduce, there are two innovative healthcare management system we developed. The first one, this we call the emergency room simulation decision support system. We know that the emergency overcrowding problem in Taiwan, that is a huge problem. Once you get into the emergency room, you have to wait maybe 1 or 2 days, then you can see the doctor and get a hospital bed. At that time, I think overcrowding always the problem in other country. So we hope we can build this type of simulation model, do the forecasting. We know that the overcrowding for the following time, like for example, following 3 hours or half day or 2 days, what problem we will face. Once we know if there are big problem, waiting time problem or overcrowding problem in the following 3 or 4 hours, we can do rearrange. We can try to rearrange the staff schedule. Okay, we can do the scheduling for the staff. Once the scheduling change, definitely we can reduce the overcrowding problem, that type of situation. So we are trying to build this type of, we call the decision support system. Okay, right now there are, I think, 2 or 3 hospitals. They use this type of the system in the emergency room, so they can focus their dynamic situation in the following time. So we call it forecasting. In this system, we can have some dashboard, and then it will show you like how many patients they are waiting in each area and what is the waiting time. So that is the system we developed. The next, let's see. Okay, this is another we call the AI detection. This AI detection we use in the operation room. We know that once you do the operation, once we do the surgery for the patient, maybe the medical doctor, they need maybe over 100 equipment. For example, nail or scissor, different nail, different scissor. Sometimes the 100 between like around the 200 pieces. In that amount of pieces, every time before the surgery and after the surgery, the nurse needs to spend the time to count the type of the equipment. Also, they need to account a number of each equipment. So it costs the labor cost. They need to spend time to do that type of things. So we are trying to use the AI technique to do the one-shot detection. We can count the amount of the type of the equipment, also the number of each equipment in a very short time, maybe only 3 seconds or 4 seconds. Previously, they need to spend every time they need to spend like 10 minutes. If they in each surgery, if they need to do 2 or 3 times, they need to count the equipment. They need to spend over like 30 minutes. So that means if we can use 1 minute to count those type of the number of the equipment and the saving the cost, I think that is pretty good for the operation room in hospital. Right now, several companies, they are very interested about this technique. So they hope they can do the cooperation with us. So right now we are trying to let this type of the product to be like a POC. So once they do the POC, some of the hospital, they can use this technique. So this is the AI technique we developed for the operation room. Actually, we know Taiwan have the good semiconductor company and the ICT company. So they already developed a lot of things to do the mobile nursing solution, smart outpatient solution, operation room solution. As I mentioned that the previous slide, we developed one, right? And we know other company, they develop other things for the operation room solution. So if you are interested about other solution in hospital, you can contact with us. We can show you what we have the other product. Actually, right now, HSC, this organization, we got the big award from the government side that we call the Technology Management Award. We long time ago, actually, this type of award, some organization from the government side, they can get this award because they developed very well known product. So they can get this product. Okay, right now HSC is a #1 multidiscipline healthcare platform in Taiwan. Let me show you the one short video for this annual meeting. Hang on a second. This video it show you the annual conference this year. In annual conference, we invite a lot of presidents from the hospital side, also the medical doctor and some industries partners. Also, we have the some partner from Canada. Yeah. So a lot of friends, they can make the new friend over here. Then they are trying to do the cooperation project together. Also, this year we have something new. Other organization, they hope they can sign the MOU with us. So in the next year, they hope HSC can help them to develop the marketing and some connection with other hospitals. Also, we have some business demonstration. So company, they can demonstrate their product in our annual meeting. Yeah, this is the stereo from Canada. Okay, they hope can develop the business in Taiwan. So they find us. Then right now we help them to do the marketing with the hospitals. In the meeting, definitely we will have some topics. Those topics we will discuss what is the smart healthcare in the following, or what the smart solution that is developed in the next. Yeah, this lady from the NHIA, that's a government organization. All the partner from the Taiwan, not only in the middle of Taiwan, actually they come from different area. In addition, we have the website hsc.org.tw, In this website, we provide a lot of information. For example, what is HSC and what is the partner over here, what is our chairman, vice chairman, what is the team. If you are interested in, you can take a look. And if you want to contact with us, there is the contact information in the last tab, and you can try to send an email to us. Then we can talk about it later. So that is all the things today I show to everyone. I don't know. Do you have any other questions? Thank you.
Thank you so much, Dr. Wang. That was very interesting to know the kind of work that HSC is doing. So we do have about 5 minutes for questions from the audience. Audience, if you have any questions for Dr. Wang, you can please put it in the Q&A box. So Dr. Wang, we'll just give them 2 minutes to ask any questions that they have.
Sure, no problem.
Yes. Okay, so the first question, Dr. Weng, that they have, the one participant has is the Healthcare Systems Consortium. They see a join member option here on the website. So
Yes.
what is the criteria to become a member of the HSC, and can people from different countries become a part of the consortium? Is there any qualification process?
Okay. Yes. Actually, if they want to join our membership, I think they have a different member fee. That depend on you come from different area. For example, if you're from the hospital side, that is another type of member fee. Also, if you come from the industry side, that they have a different member fee you have to pay. Once you sign a contract with us, at that time we provide different service. For example, I think that if you join the membership, we will provide like 3 or 4 times for the free consulting. After that, definitely you have pay extra. If you do some cooperation project with us, then I think you can have some discount for the project discount. Yeah, so that's the type of service we provide. Actually, right now, government side, for example, the government side hope us can do more cooperation with the other friends overseas. Yes, actually, right now they encourage us to do that. Yeah. So if you are interested in, hope you can contact with us. Then we will explain more detailed information, what type of the service we can provide after you join the membership. Is that okay?
Okay. Thank you, Dr. Wang. There is another question. The question is, the HSC can provide its consulting services or assistance to people
Right.
from other countries as well, not just Taiwan?
Yes. As I said that we are willing to do the service with the friends from overseas, from other country.
Oh, that's excellent. I think that is very helpful for some of the participants, because we have a lot of participants that I see from the industries as well as from universities. So
Right.
yes, I think it's very helpful.
Right. Let me say more. For example, actually, long time ago, we found out this problem. If a foreigner want to find a connection or find any product in Taiwan, definitely there is no any platform or no any entrance they can try to contact. So at that time, we are trying to build HSC. So right now, we are trying to promote HSC to other friends from other country. Once we promote, HSC, then later on they can request the service, then we can help them in this medical area. I don't think you can contact with the hospital in Taiwan. Actually, in the hospital, they are not doing the business, right? Yeah, they only do the treatment for the patients. So at that time, I suggest to contact with the HSC. Yeah, thank you.
Thank you so much, Dr. Weng. Those are the questions as of now. If there's any more questions coming from the participants after this, I think, email them to you separately.
Sure.
Yeah, thank you so much for your time, Dr. Weng. It was wonderful listening to your ideas.
Okay, thank you, everyone. Okay.
Thank you.